We've got 5 toes in each foot, so there's 5 steps basically. The important thing is daily hygiene. So we ask patients to bathe and dry their feet every day, and this gives you a chance to. And I do appreciate, as we all get older, the feet do get a little bit further away from the rest of us. It can be difficult to get down there. This is when you find out if you've chosen the right partner or neighbour, because they can look after your feet for you as well. We have had married couples in the past. In terms of diabetes itself, when I started in practice with his wife's feet, 30 years ago, the ankles up sort of thing, but about 1.2% to find out UK diabetes somebody that can help you with daily wash. UK population have diabetes. It's a hygiene issue. Now we're up to also 6%. It's an inspection issue. Where there's a high. We need patients to get familiar with their feet and patients what they look like. Caribbean, Chinese, different South Asian. We need to be looking in between the toes, make sure nothing nasty is going on there. We need to dry carefully between the toes, and you need to pat your feet dry, completely dry. Once they're dry, then that's the best time to moisturize your feet. I'll talk about that a little bit in a few minutes of time, but moisturizing the feet, I'm afraid as we all get a little bit older, the skin does tend to become drier. It's just one of those things that happen to us. Skin and nail care, a lot of patients will complain that as they get older, they feel that their nails are getting harder, etc. So what we preach is that once you've bathed your feet and dried them off, moisturize them, and then just file your nails down. And if you've got a little bit of hard skin around the back of the heel or something, file that down as well. And a bit of daily filing means you don't have to cut as often. Simple as that. Socks, we ask people to change socks daily. I'll go into socks in a little bit more detail in a few minutes. And shoes, 69% of the adults in the UK are wearing the wrong size shoes. Most of us seem to assume that if you're a size 8 when you're 25, you'll still be a size 8 when you're 65. This isn't true. As we all get older, things tend to relax a little bit. The elasticity within our tissues decreases. So the best example I can give you, if you get hold of, perhaps you've got somebody in the family who's sort of 10, 12, 15 years of age, and you pinch the skin in the back of the hand, that skin will return to sort of flat, normal, if you like, very, very quickly. Whereas if you've got, say, an 85 or 95-year-old, if you pinch them on the back of the hand, you'll see the skin takes a little while to go down, and that's a loss of elasticity within the connective tissue. So what happens in the foot, that loss of elasticity and connective tissue suppleness, if you will, that manifests itself as your feet will actually grow a little bit flatter and a little bit longer. The Americans call it foot elongation. So in vast majority of cases, we will be at least half a size bigger in shoes as we get a little bit older. And it's also noted that a lot of patients haven't paid much attention to the width of their feet as well. You need to make sure there's a good width around it. But I'll cover shoes in a few moments in a little bit more detail.